Good day, ladies and gentlemen. I am Soha, your moderator of this event. Thank you for standing by and welcome to the Coding for Urinary Stone Disease, a comprehensive review for 2020 conference. I would now like to introduce our speaker, Dr. Michael A. Ferragamo, Drive. Michael A. Ferragamo Jr., MD, FACS is the former Chief of Urology of Hempstead Medical Center and of Franklin Medical Center of Long Island, New York, and presently is Assistant Clinical Professor of Urology, State University of New York Stony Brook School of Medicine. Dr. Ferragamo is a consulting editor for Urology Coding Alert and is a coding consultant for many private practices across the United States, as well as a coding consultant for several academic institutions such as the Leahy Clinic, Burlington, Mass. Intermountain Urology in Utah, NYU Urology in New York City, and Duke Urology, Durham, North Carolina, to name a few. I would now turn the floor to Dr. Ferragamo.
And then you have the three codes, 52352, ureteroscopic extraction of a ureteral or renal pelvic stone. And bundled into these, let's look at page 6. Now, let's go to page 7 and let's look at a description of this procedure, 52356. And let's look at the code 52356, and it bundles many codes. Now 52356 is also bundled into the following codes, into ESWAL and percutaneous nephrostolithotomy. Now let's look at the AUA CMS rules for coding for multiple stones. Do not charge for multiple procedures for one stone. Here we have the AUA CMS coding for multiple stones. Let's look at 2020 Medicare payments with Modifier XS in place of the 59 modifier. And let's look at some more 2020 Medicare payments and clinical scenarios. Now let's look at a complication during stone removal. Here we have an ESWAL for a kidney stone and an ESWAL for an ipsilateral ureteral stone. And let's look at another clinical scenario, billing for Medicare. Let's look at the clinical scenario for Medicare and private carriers. And let's look at coding for renal and bladder stone, clinical scenarios with bladder and urethral calculi. A new column edit changes, and let's look at unbundling, and let's look at unbundling the other code, 52344. Let's look at the unbundling of code 52345. What about an infundibular stricture and a careless seal calculus? Extracorporeal shockwave lithotripsy. Now let's look at percutaneous nephrostolithotomy, the PCNL. We have the code 500, and let's look at the code 90081. Let's take a look at how we would code this. Stones in the duplicated urinary system. Let's look at the coding for treatment of bladder or urethral stone. Let's take a look at coding for treatment of bladder and urethral stones. CPT manual, and it's for the treatment of stones in intestinal diversion. A urinary calculi and a urinary diversion endoscopy. And let's look at advanced treatment of urinary calculi. Yes, ureteroscopy. Are you suggesting coding 50081 for the PCNL? You must do a documentation, the reading of your ultrasound in your operative report. And if you're doing that, it's best to put the reading of the ultrasound at the end of the operative report, indicating, putting down a heading, radiological report, or you can add it to the body of the operative report in a new paragraph indicating radiological report. In other words, it has to be seen to be somewhat separate so that you can get credit for it. I think, Harry, that's it, and thank you for helping me present this, and I hope that the attendees enjoyed the meeting and you were able to receive some benefit and some help in coding and getting paid for the work that you do. So thank you all very much, and I guess that's about it.